As you know, the Patient Protection and Affordable Care Act was passed on March 23, 2010. It has created a lot of confusion. It has created a lot of divisiveness around the country, but either way, it is still the law of the land. And as an insurance agent, you need to explain it to your employer clients, your consumer clients, and yourself, since you are also a participant in the healthcare system. The Patient Protection and Affordable Care Act has a number of years before it is fully implemented. And during that time frame, you will be expected to provide the best advice you can to your clients. We at Health Reform Counselors are here to help because the law is confusing and there is so much to it. It started at 2,600 pages, added another few hundred pages in a Reconciliation Act, tying it all together before it was signed into law last year. That has been slowly rolling out over the course of the last 12 months or so, and will be rolling out all the way through 2019. So when you are talking to a client, whether it's an employer or whether it's an individual, there are certain aspects of the law that have already gone into effect that you will need to explain. In addition to that, there's going to be more coming out. Regulations are being written every day. I think it was Secretary of Defense Donald Rumsfeld who said there are known knowns and there are unknown knowns and known unknowns and all that. And that is essentially what the PPACA healthcare law is. There's a lot of unknowns in the future, and the regulations are being written right now as we speak. These regulations already number over really 3 times as many pages as the law itself, and we've just started. So to avoid confusion, you need to get some education and learn about what it is exactly that you can advise a client. What we're trying to do is to just minimize the impact and have clients take advantage of the best of the PPACA law and minimize the worst of it. And there are some downsides to it, and it will be your job to explain that to them. There are over 2,000 or about 2,000 references to as to be determined by the Secretary of Health and Human Services in the law. And so that's why the regulations are not completely written yet and not completely understood. What we can do is help you at least understand what has been done to date. And we do that through seminars, we do that through webinars, we get them continuing education approved so you can get some credits while you're learning this. And our job is to keep you informed with the latest and most up-to-date information. We have a website, healthreformcounselors.com, and we encourage you to go there, look for the latest in education and webinars, sign up, contact us, and let us know how we can help you implement the PPACA law for your clients.